Okay, hi Gwyneth, it's Dr. Buford. I'm here with the rest of the team. We're just getting started on your right shoulder. We're looking in from the back to the front. We examined your shoulder before we started, and there was a fair amount of instability as we expected. And now we're looking in. Everything's magnified 30 or 40 times on the screen. Here's your biceps tendon. It looks fine. We were worried about a slap lesion, which if you had one would be right at the tip of that metal cannula. And you do not have a slap lesion, so that's encouraging. We also had a peek at the rotator cuff. You have a little bit of fraying in the cuff, but really nothing significant. That's something that's easy to trim and won't be of any consequence long term, I don't think. So we'll go ahead and do that right now. Give me a little slack on these. So we'll put a shaver in here. That's perfect. And you can see just with a little bit of suction, we can trim up the little frayed edge of the rotator cuff. This is such a small percentage, it'd be hard to even measure. Maybe less than 10% for sure. Maybe even less than that. So that's it for that. We're going to look down the front of the shoulder here in just a second. Hold the shaver here for a minute, right here. And as we rotate the camera and look down the front, we can see the anterior labrum is actually intact. And this is what we expected. You really have more of a multi-directional instability type of pattern. And here we are in the back. So we're going to get our work started by tightening up the posterior band of the inferior glenohumeral ligament. You can see the little old injury to the glenoid perhaps right there. See where it's a little dented in there. But it looks like it's tried to heal. As far as the humeral head goes, hold the camera here, please. As far as the humeral head goes, I'm going to see if there's any significant injury to the back of the humeral head. And we don't really see any, so that's encouraging. As I pull back, we can once again confirm that the ligaments are loose. You can see how that glenoid looks like an island there in the middle of the joint. There's a lot of space in there. So we're going to tighten that up, and we're going to start by working in the back of the shoulder. So what that means for us is we're going to place our camera into this, where the metal cannula is right there. So we're going to go off on the video and do that. Hold the camera there. Okay, so now we're looking from the front to the back. We've got our gray cannula coming into the joint. We're going to hold it right about there. We've got our dry dot cannula coming in here. And we've got a spinal needle in because that's what's going to allow me to plan where to place the first suture anchor, which I'd like to place right along the edge of the glenoid right about here. So that's what we're going to go ahead and do. Pull back a little bit. We're going to do this percutaneously, so we'll go ahead and make a little nick in the skin and show you how we do that in just a minute. Okay, so here's our drill guide in, just to give you the overall picture here. This is anterior. That's 6 o'clock, and so here we are just inside the labrum for our first suture anchor. So we'll go ahead, we don't want to cut it. We'll go ahead and place that down here. Hold it, reach under with the right hand, hold that. Keep it on the screen right there. Okay, Vern. Okay, once we have that down, that just makes a little starter hole for the anchor. Mallet. Okay, so there you can see the sutures. We'll pull tight on the anchor, make sure it's secure, and it feels good. Now we're going to reach in from the front. Hold that. We'll take a crochet hook, and we're going to, in a second here, take a rasp, our black-handled Liberator rasp. You can let go now. To roughen up the capsule. I'll show you what that means in a second. Pincher tool, please. Okay, so We'll take this suture out. Hold this gray cannula down now. Just hold it right there. Okay, yep. And we'll keep holding the cannula, please. Gentle, just right there. Okay, here's the instrument called a rasp. You can see it's got these sharp points on it. We just use this to roughen up the capsule and the ligament down here. Okay, and after doing that a little bit, that should be ready to go. We're going to take a grasper first. We'll show you some more in a minute. Okay, now. Here's our suture hook. We're going to start like this and go into the capsule. There's part of the first bite, and then we'll come underneath the labrum. And from there, we're going to feed a black wire called a super shuttle, or a shuttle relay. You can see it there. We'll retrieve that and show you how we use that to move the suture in just a minute. Grasper to him and turn to the left to me. Okay, so we've got the first suture pass. We're going to do a mattress type in the back in here. A mattress stitch, so we're going to do another pass with the suture hook. Here's the hook. We're going to move up a little bit to the right, which is a little bit more posterior. And you can see it's coming through there. We'll feed that through. We'll get that retrieved and tied and show you some more in a minute. Hold this. Hold this. Okay, so now we're going to tie this first mattress stitch. You can see it there. And once you tie it, it's going to create a nice reconstruction of the posterior band of the inferior glenohumeral ligament. So you'll see a knot pusher come down. There it is there. And then outside your shoulder, we're going to tie that and show you when we're done. Okay, so you can see we've tied that mattress stitch. You can see it's got a nice bumper there. We're going to now work in the front of the shoulder. So in order to do that, we've got to move some cannulas around. So we'll get that done and show you some more in a minute. Crochet hook. Crochet hook. Okay, so we've got an anterior anchor place. This is the very first one. We're going to take out one of the sutures here just like this. And then we're going to take a turn to the right suture hook. We're going to take the rasp first, just like we did in the back. And we're just going to gently abrade or scuff up or roughen up, whatever term you want to use, this tissue here. If you can just kind of do that. Okay, so we'll show you some more in just a minute. All right, let me take it. Here's our first stitch. We'll pull out the switching stick and put in a grasper. We're going to retrieve that relay here in just a minute. Okay, I got this now. Hold the cannula. Don't push it. This one, just hold it. Okay, go ahead and load it, one of you. Load that. We're just going to load that cannula outside your shoulder now. Okay, pull back on that, Kate. Hold that right there. Okay, so now here you go, Vern. So now we've got that suture passed underneath, and it looks like that. Okay, so we're going to tie that, and we'll show you some more in a minute. Okay, with your left hand, hold this. Okay, so we've got the first anterior anchor passed and tied. Now we're going to place another one right about here. Okay, so we've got two sutures passed and tied in the front. We're going to place a third, which is what we typically do for these types of problems. We're going to place a third one right about here. So we'll go off on the video, show you some more in a minute. Okay, so we've got 3 anchors in the front, 1 in the back, which is our typical configuration for these types of injuries that we reconstruct. And we're just making sure there's nothing else that we can do to make it look prettier. That looks pretty good there. We can see how much tighter things are. We can't really see down the front anymore. And we sure can't see down the back anymore. So I'm happy with the way that looks. So we're going to finish up here and get you back to the recovery room. Good luck to you now. Bye-bye.